Welcome to the American Nephrology Nurses Association's 50th Anniversary podcast series. In this commemorative series, past presidents and other leaders of the American Nephrology Nurses Association will provide a rich history of the association itself and of nephrology nursing as a specialty nursing profession. The American Nephrology Nurses Association's 50th Anniversary podcast series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. We are honored to present this episode, and we hope you enjoy these invaluable and enlightening nephrology nursing recollections.
Hi, my name is Norma Gomez. I am a member of the Nephrology Nursing Journal Editorial Board and a past president of ANNA. Today, it is my honor to interview Rowena Elliott, who served as president of ANNA from 2011 to 2012. Rowena, I want to thank you for taking time to talk with us today about ANNA and nephrology nursing.
Thank you. It is such a pleasure to be able to be interviewed like this and to share some of my feelings, insights, and experiences related to nephrology nursing and the presidency.
That's great. So let's start at the beginning of your nephrology nursing career. When and how did you become a nephrology nurse?
Well, I became a nephrology nurse in a very unusual kind of way, non-traditional. I was working long-term care, and while I was in long-term care, I really didn't care for it. I realized that was not really my thing, and I heard about a new outpatient hemodialysis unit that was going to open up in a hospital, small 32-bed hospital that I worked in previously. So I went over to interview. I figured, let me just try it because I'm always open for opportunities. I went over and I interviewed, and I got the job. Now, the unique thing about this is that I knew nothing about nephrology. I hardly remembered anything related to the kidney, but I got the job. But the great thing about it is I had someone to train me in nephrology and hemodialysis, and she was the type that did not cut corners, and I really appreciated that. And that really helped me to find my niche in nephrology nursing, and that's how I ended up loving the kidneys and anything that has to do with the kidneys even today.
That's great. Yeah, it's wonderful when you have a great preceptor and a mentor to help you through the process. As the first African-American president of ANNA, tell us what inspired you to run for office.
Okay, when I was a new member of ANNA, I went to one of the symposiums. I think it was one of my first symposiums. And I went to one of our keynote type of sessions where everybody's together and the board sits up on the stage. And when I looked on the stage and then when I looked at the members, I saw that the board did not reflect the way the membership looked. So I am a firm believer in not complaining about a situation, but putting things into action to change the situation. And I might not be able to change everything, but I can change what I can change. So that inspired me to not necessarily seek out to become the first African-American president, but I wanted to bring more diversity to the board. And my contribution of diversity was being an African-American president. So that's how that all kind of happened.
That's great. And I think that's wonderful that that's how you respond, because lots of times we do hear, why isn't there more diversity on the board? And then we find nobody is running for office. Well, run for office. Let's change it. So I'm so glad you did that.
Yes, I'm a firm believer, and don't complain about it. Do something about it. I'm sorry to interrupt you.
Exactly. Take action. What was happening in nephrology nursing, and ANNA during the time of your presidency?
The biggest thing that comes to my mind is that, and it's kind of related to something that I wanted to change, I felt like with my love of nephrology and my love of ANNA, I felt like not many people knew of this wonderful organization. And even though we were doing great things and we were getting out there and having an impact on the community, I didn't feel like other nursing organizations or other healthcare professionals really knew us to have that true appreciation and respect for nephrology nursing. So I felt as if knowing that and knowing my desire for people to appreciate nephrology nursing as much or more than I do, I wanted to, as president, to close that gap. Seeing that challenge, I wanted to help close that gap.
And I think, that part of your presidency, you always said, always remember the members.
Right. Working on the board, whether it was in my role as national secretary or my role as president-elect, president, and immediate past president, something I realized is that we worked so closely together and so frequently together that we could easily shut out others because we work so closely together. So it just, like an epiphany, like a light came to me. And I just realized we need to realize that in all of the work that we're doing, we're not doing it for us. We are doing it for the members of this wonderful organization. So whenever we would have our meetings, I would have Luann Leary to put a tent card up. And that tent card would say, always remember the members. So when we would have discussion, when we would have agenda items, when we would vote, I would always want the board to remember our members.
That's great. And on our organizational chart, the members are at the top. So that's right. Great reinforcement. So what was the biggest advancement for nephrology nursing or ANNA during your presidency?
Well, the biggest advancement basically goes back to what I felt like was a big challenge, that gap in people being knowledgeable of the organization and the wonderful things that we were doing. So it was one of my major goals was for us to establish partnerships with other organizations, healthcare or otherwise, so we would be more visible. So we had a partnership with AKF, American Kidney Fund, with the PARA initiative. And with that, there were 5 other organizations and ANNA. We were the first 6 organizations to start this initiative. And the purpose of that initiative was basically to have women pair with one another so then they would become knowledgeable of preventing chronic kidney disease and then spread that message on to their families. We also partnered with First Lady Mrs. Michelle Obama and Dr. Jill Biden in the Joining Forces initiative. And the goal of that national initiative was to work towards providing physical and mental health care to those serving in the military and their families. And with the Joining Forces initiative, it wasn't just ANNA and the First and Second Lady. It was ANNA and all of the major leaders of the nursing organization. So that was an absolutely wonderful initiative for us to be a part of. One other initiative or collaboration that we did that I was so proud that we were able to do is that we joined with 2 other renal physician organizations in order to establish a partnership where we would be able to publish in one another's journals and to be able to speak at one another's conferences. And I felt like that was a really big accomplishment because a lot of times as nurses, we don't think that we can partner with physicians and vice versa, but that just showed that it is possible and that could be a foundation for things that we can do and have done in the future.
That's great. And I think that is so important for the visibility of ANNA, the partnering that you accomplished during your presidency. Thank you for that. What do you see for the future of ANNA and nephrology nursing?
I see a continuation of being more visible and efforts toward being more visible, not just to ourselves, but to other healthcare professionals and the nephrology community. I also see us really doing more, continuing to do what we are doing and at a grander scale, being more and more involved in health policy because we see that as nurses, the only people that can speak for us truthfully and with validity and reliability are us, and nephrology nurses can only speak for us in a realistic way. So in order for us to be able to voice our concerns and the challenges that we face as nephrology nurses, we have to be involved in health policy. Also is expanding our education and looking at things, approaching things from more electronic avenues, although we're doing a whole lot in that realm, but all encompassing and embracing a lot of the newer or things that are innovative electronic ways that we can communicate and share information.
So true, and it's so important with the advocacy and health policy. So before we end, Rowena, is there anything else that you would like to share about your nephrology nursing experiences?
I can say that I've been a nephrology nurse since back in the early 90s. And it has been one of the better things that has ever happened in my career. ANNA has been a wonderful influence on my career. It has provided me with a lot of educational and leadership opportunities. And I truly enjoy being a nephrology nurse. I tell all my students I love nephrology, and I'm just glad that this is my niche. I never intended for this to be my niche, but the way nursing happens, you find your niche along the way. And I am truly proud to be a nephrology nurse, and I'm truly proud to have been a past president of ANNA.
So, Rowena, thank you so much for your service and leadership as president of ANNA and for allowing us to interview you today. We really appreciate your taking the time to talk with us. Thank you.
And thank you, too. I appreciate it very much.
The American Nephrology Nurses Association's 50th anniversary podcast series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. This series is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. For archived episodes of this podcast and to learn more about the American Nephrology Nurses Association, visit the association's website at annanurse.org. You can also subscribe to this podcast on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.